In Lorengau, Manus province, 22 community health workers have been officially inducted by the National Volunteer Service to strengthen rural healthcare delivery. The week-long induction program held at the Manus College of Health Sciences from May 25th to 29th was opened by Provincial Health Authority Chief Executive Francis Posse. Deputy Director for Public Health Ella Michael reaffirmed the province's commitment to overcoming geographical barriers and praised NVS as a vital partner in addressing health service shortages in remote communities. She expressed gratitude for the support in improving access to healthcare, particularly in hard-to-reach areas. NVS Director Kelly Icy explained that the initiative is designed to sustain short-term contract health workers by inducting them as volunteers until they are formally absorbed into the government payroll. He described the training as an important opportunity for frontline workers. Over the course of the week, inductees received training on NVS policies, community engagement strategies, and volunteer ethics before being deployed across Manus province. They learned what it means to be a volunteer.
Serve without any rewarding payment. Abide to the community policy on lifestyle. Expansion upon that. Every bullet point links as a volunteer to work with the community which have. The other thing, we have to be certified, meaning we come to training like this, we have papers and then we go into the community to deliver service. Without complaining of where we are, we mentioned it in the bullet points, the remote areas, especially we're going to go into the remote areas. So what we do in the community, that remote area that we go, we won't complain of the mud if we go on top of the mud, or the house that we sheltered under, this roof, that opening roof and there's rain coming inside. We just fit into the situation of the community. And eventually that you have to work wholeheartedly with your heart, to sacrifice for the job that you're going to the community to do. And that's a bullet point, our last bullet 26. A certified person. You don't just go into the community and do the job. You have to be certified. As long as we are sitting in this room, we are working towards the paper that we're going to sign and be certified to go into the community. And when we go into the community, we don't complain about the area that we're going to stay. It doesn't matter about the distance. You're going to hop on the boat or then come find vehicle to go to the hospital, the main hospital. You will just work and follow the situation that the community is in. If also carry patients now walk about time, in a longer distance, you go walk on them, you will follow them. You won't complain. That's why we describe volunteer in that way. You won't complain about the situation or wherever you are, and you will just fit in and follow the lifestyle. That's the meaning of volunteer. That's how we understand it.
They also learned what it means to sacrifice their time in volunteer work.
No complaint and like I'm brief, but it's breaking down the kind of sense. On the classic example of no complaint, like geographic location na. Ayun sa only makinilo basta one la halfway. O sa antam to highway ya. And so mi man mo werin su sa werin long ta trausis you go lahat. You na werin su na werin long ta trausis doy mas werin so ta trausis na broken ground na then you go. And kind of sense. Or all put you go lo. And so one place where long like Western. You know man local up boat. Can example Batajeria. Batajeria lo Highlands. Batem kamol kutumen ko pani selwe and se very no content oy. Bambi ko du tatay na mission sila kay tonokan. And sacrifice ya. Oh, human do tao, human lo kaya kakaro, bol pipin long maya ba yung kumpin lo, kaya chicken, kaya rice. So, ano kata yan? Like sacrifice I'm explaining sacrifice. So, by religious to religion.
And they learned the reason why their service is vital.
We are skilled people, we are skilled to. We are trained to provide healthcare, give them all first aid, marasin, suit, help him sick man. That's our skills. A form of providing counseling or advice or assistance in providing peace. As we are health workers, sometimes you mean like deal one time or sick. You get sometimes more come on them presently complain of law one time of violence. So violence he come up, you got him reason behind the violence he come up. So you must provide him some counseling. That's part of service we are giving. Narapla definition of service is a form of work or task that is provided to the various parts of communities and villages. Sometimes, some customs, some one on areas you work long, in line one time. So in order that you change him all, you must fit in the sub all. Like first time you love all to, you see much no rambucho line to fight, or line to cutting man. Only got him attitude problem. But we go and we experience something. So in order we see now we go all studying weight all. Yeah, we start. Putting me out, let me start. No, this is right, but you must make no sense. That is my service to them. And one examples, as I am a health worker, we will provide them health services in various ways we can provide him. We provide him health care, no more suit, marasin, or routine immunization, we give him. In counseling, we step in. In violence, we step in and we taking responsibility to yourself. Health worker, we give him service. When we can make it, we provide him. One kind of health education, agriculture, you got all skilled man agriculture stuff, they are providing service. So as community development, when you need the community development stuff, the person is responsible or the skilled person can step in or providing service.
This program marks a significant step in boosting healthcare access and empowering local communities.